Welcome back to West Texas View.
Welcome back to the West Texas View. I'm Johnny Lou Avery, and Dr. Ted Mitchell is our guest today. He is the new president of the Texas Tech University Health Science Center, and we've been talking over the last Sunday and today's program about his vision for medicine, his vision for our part of Texas, his vision for the Texas Tech Health Science Center. And since we have two very strong centers here at Odessa and Midland, very groundbreaking centers, then I want us to talk specifically about that. But before we do, have we talked about everything that you wanted to talk about the specific programs? I know that when the the physical therapy program came online, that we had 20 slots to fill, and we had about 144 applications.
Sure.
So,
well, no, I think that it's worthwhile to visit some about the specific programs that are in the Permian Basin area. And again, what is important for people to remember is that the system as a whole operates in sync with itself. So, for example, I think most people know that recently Texas Tech opened up a full 4-year medical school in El Paso, the Paul L. Foster School of Medicine. Whereas before it had been what's called a regional campus, the 3rd and 4th year students would go out there. Now they're doing their own recruiting and getting their own students. Now people would think, well, how does that affect the Permian Basin area? Well, it affects it directly, because the students who previously we had been sending as a regional campus to El Paso, they have to backfill into the current system. So those 3rd and 4th year students who previously would have gone to El Paso, they can't go out there anymore because they're now recruiting their own students. So they've got to come back into the campuses in Amarillo, in Lubbock, and in the Permian Basin. So what it does is it increases the presence of our School of Medicine in those areas. Because remember, when you've got a population area that for the most part is very sparsely populated, we have these hubs of population density, the Permian Basin, Lubbock, Amarillo, Abilene, where from an educational perspective, you've got to have your students in those areas in order to get the type of educational experience they need for their area, for their discipline. So the Permian Basin School of Medicine will increase in its number of students as the Paul L. Foster School of Medicine in El Paso increases with its 4-year students. So, I mean, it's the people will say, well, golly, you know, if I'm interested in helping, and I love Texas Tech, but I'm really interested in the Permian Basin.
That's right.
How will what's going on in El Paso affect me? Well, it'll affect you favorably here, because as those students are redirected here, there's increased what's called formula funding with each student that comes from the state to the Permian Basin, and to Lubbock, and to Amarillo. So in that sense, the rising tide raises all boats. And as our system does well in the Permian Basin, it does well in Lubbock and Amarillo. They get the benefits of that. As the system does well in El Paso, the rest of the system gets the benefits from that, because it's one fluid system that operates within itself. So for the Permian Basin area, there will be an increase in the School of Medicine, the number of students in this area. We also have a wonderful physician's assistant program, part of our School of Allied Health Sciences in the Midland, on the Midland campus. We have the physical therapy programs, as you had mentioned, and we have a School of Nursing. And these are all critical parts of our missions for educating healthcare providers and providing service to patients and providing research to the system. They're critical parts of our mission, and they're also vital parts of the Permian Basin economy.
But let me follow up with something you said. All right, let's say that I have some extra money and I'm wanting to give some scholarships to a nursing program, and I want it to go to my nurses in the nursing program at Midland. And so if I give it to there, then I know that it'll be used for those nurses and not for El Paso or Lubbock or Abilene.
And here's what I would say with that is, as a program develops, that, you know, if you're from the Permian Basin, or if you're from Lubbock, or if you're from Amarillo, everybody would like to see that. They'd say, listen, I grew up here in Amarillo. I love this area. I love Texas Tech, but I'd really like to make sure that I'm helping kids from Amarillo. If you've got a fresh program that's just starting, what you'll oftentimes find is that initially the folks in Amarillo really don't know much about it. And you'll have 20 slots 150 applications, and maybe one of them's from Amarillo. So if you've had somebody that says, listen, I wanted to give some money for scholarships, and I wanted to give scholarships for 8 kids, but they all have to be Amarillo. What that means is, effectively, you're not giving scholarships.
Because you just have one that applies
That's right.
to your criteria.
So if you said, though, look, I want to help the Texas Tech system with the understanding that in the broader sense of things, we are directed toward the health care of West Texas, which involves Permian Basin and Amarillo.
Okay.
And as Amarillo does better, I will do better in the Permian Basin. Therefore, yes, I would like to, if possible, make sure that that scholarship goes to Permian Basin kid first. If it doesn't, and we've got a really a bright, smart kid from Amarillo that wants to work here in the Permian Basin, bring them on. Because I'd like to show them what the Permian Basin's all about. And one of the things that's a little known fact is where folks wind up training, they typically wind up living.
That's
so you
right.
wind up using it as a recruiting tool, saying, I would like to, for example, help support a residency program here in the Permian Basin, knowing that if we can get them to come here from whatever region, from Longview, Texas, wherever, then they're going to statistically wind up being more likely to stay in this area.
And besides, sometimes they can't, because of lack of space, they can't get into a program in Dallas or Amarillo or somewhere, and so we do have a slot that they'd meet here if they've got some kind of financial aid.
Absolutely, and see, even with that then, if we have somebody, let's use the Amarillo example again, if you had somebody in Amarillo that says, okay, I'm willing to give a donation, even if that student winds up training in the Permian Basin, well, that's the best of both worlds for us.
Absolutely.
Because then it allows us to use our system. And see, the strength of Texas Tech is the flexibility of the system. To say, listen, I'll tell you where we need your help. Right now, this particular year, this particular academic year, we need more students in the Permian Basin. Or this particular academic year, we need more students in Amarillo. It gives us the flexibility within our system, with a system that's completely connected to itself, to be able to operate.
And that brings up another point that I want us to mention briefly, is that there's a lot of ways people who are not going to school as nurses or doctors or anything can get involved and actively support through the donor program or through the just supporting the programs and the information, sending it out to all of their relatives. If you want to go to nursing school, stay right here in the Permian Basin. We're going to take another break, and when we come back, we're going to specifically concentrate on the vision of what's happening here in the Midland-Odessa Center. Join us in just a minute. Okay.
Stay tuned. West Texas View will be right back.